are going to now bring Dr. Pritesh Mutha onto the stage. He is a triple board certified physician in internal medicine, gastroenterology, lifestyle medicine, and he is an associate professor at UT Health in Houston. He's also published several peer-reviewed publications in top medicine journals. He is the co-founder of a non-profit organization, Stress Academy. I know a lot of us could use that, right? In this session, he's going to discuss the role of rich fiber, plant-based foods in fostering that healthier gut biome we just learned about. And we're going to talk about how to reduce your risk of inflammation in the bowels and other autoimmune diseases. So please welcome him to the stage.
Did good. Can I take the mic? Hello everyone. Thank you for being here. Thank you, Dr. Chawlas, for the opportunity to be here and talk about this topic, which is close to my heart, close to my gut, I would say. And thank you, Dr. Bruce, for such a wonderful talk and talking about gut microbiome, kind of laying the ground for my talk. So it worked out perfectly. So we will learn all about what is gut microbiome, what is autoimmune disease, and how it's actually interrelated and how we can work on it. All right. So just space, right? Doesn't work.
Sometimes it doesn't click over.
So click on it.
Space will work now.
Okay. All right. So whole foods, plant-based diet versus autoimmune disease. Just quick story, because Dr. Bernard and Dr. Greger are here today. Michael Jordan, you all know Michael Jordan, right? So Michael Jordan was playing a game and there was a rookie. So Michael Jordan scored 68 points that day and the rookie scored 1 point. The reporters come afterwards, talk to him, how do you feel? He was like, I and Michael Jordan scored 69 points today. And I feel pretty much the same way today with Dr. Barnard and Dr. Michael Greger here. So I'm very, very excited and happy. I have a fanboy moment today. Okay, so we'll learn about some case studies. What is an autoimmune disease? What is gut microbiome? So we've heard that word over and over, so we'll understand that a little bit more. Interaction between gut microbiome and your immune system. How does it work? How does it strengthen you or weaken you? Factors that cause unhealthy gut microbiome and how to improve your gut health. So we'll learn a little bit. I don't think I'll go over time, but if I do, please warn me. All right, so just a few patient stories. These are my patients. A 39-year-old female with Crohn's disease, very busy at work, 3 kids, lots of pressures and bad disease, taking medicines, not working, symptoms are debilitating. So then she got one surgery, they gave her medicine, still wasn't doing any good thing for her, she was still suffering. So somehow she reached me and I was like, okay, are you willing to change? And she was, yes, I'm willing to do everything. So I changed her diet and lifestyle. In 3 months, she was symptom-free, disease-free, and medicine-free. Thank you. 45-year-old male with ulcerative colitis. So Crohn's disease, ulcerative colitis, these are inflammatory bowel disease. I hope you all know something about it. Your gut gets inflamed, and it's not like you treat with antibiotic and it goes away. It stays with you for lifelong, and you take medicines, thousands of dollars worth of medicine, and it doesn't go away, just a band-aid treatment, symptom management. So same thing, ulcerative. The disease is quiescent with diet, and 5-ASA is one medicine that we give, very simple medicine, but relapses with poor diet. He does not follow the diet properly, but whenever he follows, he's in good condition, he cheats. He's like, my mom comes and she does not listen to me, she feeds me all kinds of food, and bam, symptoms are back. So, and there is this 53-year-old female with ileocolitis for 6 years. Ileocolitis is basically Crohn's disease, where ileum, the last part of your small bowel, and colon, large bowel, is inflamed, and she's been well controlled purely on diet and lifestyle. Although she cheats sometimes, so it's not 100% in deep remission, as in completely gone, it's still there, but they're working. So let's understand what is an autoimmune disease. So follow me. Just look at the left side of the picture here, slide here. So normal immune response. What is normal immune response? When an invader, like a virus or bacteria or food pathogen or any chemical that enters your gut, what our body does it identifies that there is a foreign body, and then it sends our immune cells and creates identifies the antigen, creates antibody, a fighter cell against that antigen, and that's essentially your normal immune system to prevent harm from this antigen. That's really a normal autoimmune system. Now, what happens in autoimmunity? Auto means self. What happens is there is this foreign body, be it bacteria, be it virus, be it food, pathogen, or antigen, or chemical. Now it has access to our gut wall. So it alters our normal gut lining. So now it enters inside and it has access. Now body produces an antibody against this, but what happens is these soldiers not only attack that pathogen, but they turn around and attack you as well. They're like, oh, I see something similar in your body, and it goes and attacks that. And that's nothing but autoimmune disease. So that's autoimmunity. You understand? Everybody understands this part? Very important. All right. So what are types of autoimmune disease? So Dr. Bruce talked about skin diseases. Pretty much every part of your body can suffer from your autoimmune disease, be it all kinds of allergies, asthma, systemic lupus erythematosus, right? SLE we call it. It essentially involves all organs. Multiple sclerosis, brain, you name it, rheumatoid arthritis, psoriatic arthritis, celiac disease, scleroderma, type 1 diabetes, Graves, psoriasis, every single thing that autoimmune disease from top to bottom, the cause is the same. All right. We're going to focus a little bit more on inflammatory bowel disease, that's gut, gastroenterology, makes sense, right? Then celiac disease, again related to gut, rheumatoid arthritis, type 1 diabetes, thyroiditis. So we'll understand that how it works. So what is the root cause of more than 80% of illness and health in your body? Raise of hand, show of hands. How many think brain is the root cause of illness? And stress plays a role, but how many of you think that's the root cause of all illness? Nobody. All right, heart, lungs, gut. All right. Might have given a little bit of a clue there. So, all right, of course it's the gut. No bias whatsoever. So what is gut microbiome? We heard a lot about this in last talk, and we've heard this over and over. So let's understand what is gut microbiome. Everybody understands gut, right? Microbiome means microorganisms in your gut. So these could be bacteria, fungi, virus. 100 trillion of them are sitting in your gut. About 100 trillion. Sometimes they have up to 3 to 4 pounds. They're sitting in your gut. More than 3,000 different species, mainly two broad categories. There is Prevotella species and bacterial species. One is good, one is bad. Microbiota genes, more than 150 times the human genes. So our genes, when we say our genes, we are not just talking about my gene. We are talking about genes all together with these 100 trillion bacteria and my own personal genes. But whatever happens to my body, 90% of it is happening because of these bacteria. Less than 10% because of my own personal genes. Remember that. That's why these microbiome, the talk about microbiome, the gut microbiota, microorganisms, these are all synonyms. We need to understand they are the ones playing a big role in our health. And that's why genes are not playing a huge role. We talk about genes and we heard so much about identical twins, right? Identical twins, and some of them have disease, others don't, because it's not just your genes, it's these bacteria that play a huge role. So let's understand the interaction between gut microbiome and gut wall. So how do these bacteria work with your gut wall in effect? All right. So healthy gut microbiome is healthy gut, right? So microbiome genes produce hundreds of different chemicals, and these chemicals are important for all kinds of processes in your body, all kinds of reactions, chemical reactions, burning, absorbing, secreting, excreting, whatever you name it, building blocks, every single thing, these microbiota, microorganisms play a role, their genes play a role. Digestive enzymes breaks down these complex starches, right? So these bacteria, so whenever, what is complex starch? Nothing but fiber, right? And these bacteria break down, producing these digestive enzymes, they break down these fiber. Now what happens when you break down these fiber with the help of this bacteria? They produce short chain fatty acids. These are fatty acids, but they're specific, the compound is very specific, short chain fatty acid. Very, very important. It only comes by breaking down fiber, nothing else. What are these? So butyric acid. This acid, butyrate or butyric acid, it is the source of colonic cells' nutrition energy. So in your colon, your large intestine, the cell's food is nothing but the breakdown product of these bacteria by the fiber breakdown product, which are broken down by the bacteria. So butyric acid, if you don't have that, that's a problem. Your colonic cells starve, they get inflamed, and they give access to all the bad bacteria to your gut. So very, very important. And not just that, it just does not give good food, but they also stop all the cancer-causing cells. So if you don't have enough butyric acid, you're predisposed to causing colon cancer. Fiber is extremely crucial. Acetic acid, that's second short chain fatty acid. It provides muscle energy to your muscles and liver. Third is propionic acid or propionate. What it does is, it goes to liver for production of ATP. But we heard about GLP-1 agonist in this morning during Dr. Barnard's talk. Do you remember that? Glucagon-like peptide that our body produces. And Ozempic and Wegovy, these are the drugs, expensive drugs, they work on this receptor. We get it for free. You just eat fiber. Fiber will be broken down by these bacteria, will produce this propionate, and it will do exact same thing without the horrific side effect of this medicine. See, I'm a gastroenterologist, and in that I'm an advanced endoscopist. So I get a ton of these patients who are taking these medicines and come to me with gastroparesis and all kinds of issues. And I do fancy procedures. It's good for business, as they say, but it's not good for the patients. Absolutely not good. And thousands of dollars. These drugs are costing thousands of dollars. And sadly, people celebrate when they get approved for this drug. I'm like, this is the worst drug you can take, but people are taking non-stop and just celebrate that. So you don't need that drug. You don't need $1,500 per month. Just eat fiber-rich foods. All right, gut microbiome chemicals. This is another important thing. So primary bile acids, they're turned into secondary bile acids in your colon. Ideally, when you eat fatty foods, your bile produces, your gallbladder or your liver produces bile, and this bile is actually, there's something called as enterohepatic circulation. This bile will carry fat, and then it will go all the way to the last part of your small bowel, will get absorbed into your system, and it circulates. But if you eat a lot of fat, then there is a lot of bile acid, and body does not have enough capacity to reabsorb. So it goes into your large intestine. And then large intestine, there are bacteria which break down this primary bile acid to secondary bile acid. One of the worst things. You'll have symptoms like diarrhea. That's quality of life, pretty bad. But that's the minor problem. The bigger problem is it will predispose you to all sorts of cancers, inflammation, and also the gallstones that is very common nowadays. Back in the day, they used to say overweight females in 40s will get gallstones. Now we see males and females starting from teenage years till 80s and 90s. So it is exponentially grown almost 20 times the volume. So bile acids, secondary bile acids are very bad. Dr. Barnard talked about calorie trapping by fiber. Fiber traps these bile acids too. So fiber has multiple roles, takes out all the toxins as well. Plays important role in health and disease. These gut microbiome also produce vitamins K, B12, biotin, folate. So B12 does not come from animals. We'll talk about that in a little bit. Inhibits bad bacteria. So good bacteria will inhibit bad bacteria. They'll regulate our immune system, protect against infection. 70% of our immune system, 70% of our immune system is in the GI tract. How many of you knew this part? Good, good, very good, excellent. So we always thought our immune system is in our blood or in our bone marrow, but major part is in your gut and it's under your control. How you activate or mess with it, it's completely under your control. So good chemicals by good bacteria will help us digest food, help us lose weight, improves our immunity. So that way you don't end up with any infection, autoimmune disease, cancer, and improves our response to medicines or chemotherapy. Well, if you have a good diet, you don't need medicines. If you have a bad diet, medicines don't work. But if you have a good diet and you're taking medicines, they're more likely to give you a better response. On the other hand, bad bacteria, bad chemicals lead to poor digestion, obesity, impaired immunity, so you end up with recurrent infections despite multiple medications and all sorts of modern treatment, autoimmune disorders, cancer, impaired response to medicines, and chemotherapy. All right, so you are what they eat. We used to say you're what you eat. No, you're what they eat. Of course, you're eating it and that's how they're getting it, but you're what they eat. So water the plant you want to grow, feed the bacteria that you want to grow. Good bacteria is fed by fiber. Excellent. All right. So interaction between gut microbiota and immune system. Now this is the core slide. If you understand this slide, you got it. You understood all the lectures that have been talked about since morning, and Dr. Bruce has talked about gut microbiome. So this is a picture of your gut wall. Here is the gut lining. This is the inside of the wall, and that's the lumen where food and everything goes by. So this gut wall makes sure that is internal environment and external environment are separate. They talk with each other through these protected mechanisms. So there is a nice green layer that is called mucin layer. It is a protective barrier. Then this is the cell wall, and it has tight junctions. These tight junctions, they make sure that nothing goes through that tight junction. Now, when you eat poor diet, you take these medicines, harmless medicines that we think like ibuprofen, or naproxen, diclofenac, even these simple medications, they mess up that mucin layer. So now your protective barrier is going down. You take all these chemicals, all the foods that have preservatives, emulsifiers, they emulsify this mucin. Now they have direct access to the gut wall. They break down the gut wall, tight junctions don't stay tight anymore. What happens? They're leaky now, they're loose. Leaky gut, which Dr. Bruce talked about earlier. So that's how your protective barrier was broken. There's leaky gut. Now those bacteria that never had access to the internal environment now have clear access to your internal environment. So now they have access, they came down here. Here our immune cells are sitting and waiting. They're looking for any foreign body and they start attacking that stuff, right? So now all the things that you're eating, they have access to it. Your immune cells start producing antibodies against it. And these antibodies, many times, these antigens that came inside, they resemble many antigens in your own body, which our body never produced any antibodies against our own antigens, but they produced antibodies against these foreign antigens, which our immune system later on realized they sit in our own body and they start attacking our own body, and you have now something called as autoimmune disease. Autoantigen mimic inflammatory response. So these foreign antigens all of a sudden have access and trigger something called as autoimmune disease. So if you understand this part, you will realize how important it is to maintain that gut barrier, to maintain good bacteria. Bad food end up leading to bad bacteria, plus all the other chemicals, bad access, and now you're in trouble. Same slide, just simplified version. So that's the cell protective layer, broken cell wall, access, damaged, leaky gut, poor absorption of food, systemic inflammation, nutrient deficiencies, food intolerance, chemical sensitivity, and autoimmunity. So this is what Dr. Michael Clapper, he was a keynote speaker last time, he had this slide on. So he calls it a red tide. right? Red tide. So that's the red tide, that's the lumen. If you look at all these items here, so maltodextrin, you will see lots of foods that you eat, processed chemical foods. Start reading the ingredients. Start reading these chemicals, and you will see that, oh, I read about that here. So maltodextrin, very high glycemic index, even higher than sugar, kind of causes problem. Fructose, polycyclic hydrocarbons, alcohol, even that one glass of wine, extremely bad. Every sip of alcohol is bad. There is no safe limit. Aldehydes, detergents, what kind of detergents you use. They, even when you have dishwasher, some of these microparticles of detergent stay on the vessels that your utensils, and that enters your food. Animal protein, oxidized peptides, free radicals, bacterial peptide antigens. So many times the meat, they have lots of bacteria on top of that, and these bacteria break down into endotoxin, and they get access into your gut, toxemia. You're fatigued, tired, you don't have energy, and of course, it triggers all sorts of infection, inflammation, autoimmune diseases. So we heard about stool transplant or fecal transplant. What it does is, basically, you take a healthy gentleman and take their stool and process it and transplant into a unhealthy patient. What it does is, it's inoculating good bacteria into a person with bad bacteria. And what did they see? Ulcerative colitis, that is one of the inflammatory bowel disease. Patients received stool transplant from healthy people. Their symptoms improved or even resolved. But that's just proof of concept. That means, okay, if bacteria changes, things can improve. But if you keep eating bad food, these bacteria are going to change into, again, bad bacteria. So it was just to understand that we need to change something. Same thing for depression too. Happy patient stool, depressed patient received it, you end up with happy patient. All those chemicals are playing a role. They talk with your brain. This was one study that was published in 2022, actually, in Gut. It's a very good journal in our GI world. It's a European journal called Gut. And this came out of AIMS, that's a medical institute in India, #1 medical institute, top-notch medical institute. And this study, what they did was, they took patients with inflammatory bowel disease. And one arm continued their standard medical therapy, that is SMT. And the other group did not get any medication. They gave them fecal transplant, and they started on anti-inflammatory diet, which was very fiber-rich, and they almost got rid of all the animal protein. There was some they left behind. It was not perfect, but way better than what they were consuming. 8 weeks later, clinical outcomes. Clinical outcomes means symptom-wise. Look at that. So the people who were receiving standard medical treatment versus those who went on change in diet and stool transplant, double the response rate. Odds ratio was 3.5 in terms of improvement. And 48 weeks, almost a year later, still just those patients who are not on medicines did way better than those who are on medicines. Now that is symptom-wise. We are talking about, let's talk about the findings on colonoscopy or endoscopy. And what did we find? Deep remission. That means mucosal healing. The mucosa has healed at microscopic level when we biopsy. Again, patients who received stool transplant and diet, way better than those who were on medication. Look at that. 9%, such a dismal response rate. Those who got standard medical treatment. And these medications are extremely expensive, extremely toxic, and they do really a lot of damage in long term. And deep remission at 1 year, 25% versus 0%. Those who receive standard medical therapy, 0%, drastic. Another study in Japanese patient population, what they did was, when patients come to the hospital due to exacerbation of disease, they were like, you continue doing what you're doing, continue taking your medicines, we're going to continue that. But if possible, change your diet, cut out all the animal products, start on vegetarian diet. Now, of course, not everybody listens, but they followed up. So those who listened, they went on semi-vegetarian diet. They just cut out a little bit. And look at the outcomes 1 year later versus those who continued to eat meat. So those who were eating meat, their response rate dropped significantly. Hello? Yeah. And those who are on semi-vegetarian diet, 1 year later, look at their remission rate. So that means remission means the disease did not recur. Just by changing their diet a little bit also had such amazing response. Molecular mimicry, that's what I talked about in that slide. So molecular mimicry causes celiac disease. Now celiac disease, have you heard of celiac disease? Gluten sensitivity, right? And what do we say? Oh, we ask about, oh, is there anybody in family with celiac disease? Because it's genetics, right? Well, it is antibodies against our own enzyme called tissue transglutaminase. So our body has this enzyme, tissue transglutaminase, and our body produces enzyme against it. So how does that happen? There is a gene, or there are two genes, HLA-DQ2 and DQ8, but 30% of the population has that disease. Only those genes, but only 1% end up with this disease. Why does that happen? So there is enzyme in lots of baked goods and meat products called microbial transglutaminase. If you start reading the ingredients, you will see that it's there, or you can Google it. And so now it has access to our gut wall because we have inflamed the gut wall. So body produces antibodies against microbial transglutaminase. These antibodies now turn around, they're like, wait, there's something similar. Tissue transglutaminase, and you end up with celiac disease, gluten sensitivity. Molecular mimicry, same thing for diabetes type 1. Of course, this is a theory that autoimmune disorder against insulin. So type 1 diabetes is autoimmune disorder against insulin producing beta cells in our human pancreas. But what they say is beta casein in cow's milk, similar to human beta cells. So it looks exactly similar. So if you're consuming dairy products, it has access to your gut wall, and you're predisposed genetically, then you're more likely to end up with type 1 diabetes. Dr. Parikh's talk earlier today talked about cow's milk causing so many problems in your gut. Another problem. Arthritis, the same challenge. Hashimoto's thyroiditis. Every single autoimmune disorder is molecular mimicry. So diseases due to unhealthy gut, irritable bowel syndrome, inflammatory bowel disease, immune disorders, infections, cancers, GERD, constipation, everything. Everything. All right. So factors that cause unhealthy gut microbiome. What is the most common nutrient deficiency in Western world? Protein deficiency? No. Vitamin B12? No. D? All right. So less than 5%, as Dr. Parikh mentioned earlier, 3% people, or Dr. Riz mentioned, 3% people get recommended daily intake, which is 28 grams for females, 40 grams for males. What doesn't have fiber? None of the animal products have it. So dairy products, 0 fiber. Eggs, 0 fiber. Meat, 0. Refined and processed foods, 0. So no fibers in any of these things, but loaded with inflammatory stuff and toxins. Fiber deficiency also causes longer transit time. So food takes much longer to come out of your gut. So it sits there, rots, ferments, causes more inflammation and toxins. Antibiotics and other medications, toxins, poor sleep, lack of exercise, stress, method of birth, these are just added things, but main thing is diet. Unless you fix your diet, there's going to be problems. All of this increases your inflammation. So how do you improve it? Foods rich in fiber. So fruits, grains, legumes, vegetables. You've been seeing this all day long, and nuts and seeds. So whole foods, plant-based diet, full of fiber, and microbiome thrives on fiber. Goal is more than 40 grams, but as Dr. Riz also mentioned, 100 grams a day is what you strive for. And when you go on a whole foods, plant-based diet, you're easily going to meet that recommendation. And should be whole foods, not fiber supplement. Fiber supplement is not going to work. So none of these things, no animal products, no processed foods, no chemicals, preservatives, emulsifiers. Anything that goes from farm to factory to table should be out. Anything goes from farm to table should be in. So for B12, go out, get exposed to natural soil. It has bacteria, which bacteria produce B12. Even a lot of meat eaters are B12 deficient, which is, so that's very important for your synthesis of B12 and improves your immune system. All right, so healthy gut microbiome, poor diet and lifestyle becomes unhealthy, and you change it, becomes healthy. So in summary, human gut microbiome plays a crucial role in autoimmune disease and overall health. Most common nutrient deficiency is fiber. For healthy gut microbiome prevention and treatment of autoimmune diseases, must consume fiber, more than 40 grams but close to 100 grams, from whole foods, plant-based diet. Avoid all animal products and processed foods. Outdoors, go outdoors, be with nature. Exposure to soil to replenish your microbiome. And that's pretty much it.